Hello, and welcome to our conversation about the importance of home medication management. There is so much important information and new technology available these days in the realm of home medication management. We felt it was an important topic to include in our family caregiver program. Caregivers will learn so much from Dr. Hutchison and her knowledge on this topic. My name is Laura Spradley, and I'm the Outreach Coordinator for the Arkansas Geriatric Education Collaborative at UAMS in the Department of Geriatrics. Today, I'm happy to be here having a conversation with Dr. Lisa Hutchison, PharmD and MPH, in the departments of both geriatrics and pharmacy practice. She is dual board certified in pharmacotherapy and geriatric pharmacy. Dr. Hutchison's focus is on older adults and teaching pharmacy and other trainees to improve medication use and work as a team. She lectures annually in geriatrics and in pharmacotherapy, certification courses for pharmacists, and is program director for the Population Health Management Pharmacy Residency at the College of Pharmacy. You are a very busy woman.
Thanks for having me.
You bet. Thank you for being here. So Dr. Hutchison, let's just talk in basics to begin with. Why is it so important that really anybody, but we're specifically talking about older adults, take their medication as prescribed?
It's so important for older adults. They have so many medications, usually more because they've developed more chronic illnesses over time. And so it can be very difficult to manage that at home every day. So it's important to manage that because taking your medications is just like having a balanced diet or exercising regularly, which we all know is helpful. Sometimes if you forget to take your medications, you're going to put yourself at risk for having a disease flare-up or for having to go to the hospital or even to the nursing home. So we want to be sure that patients can stay at home independently for as long as possible and that their caregivers have as low a burden as possible as well. We also are looking to reduce the risk of side effects and drug-drug interactions and make sure that a patient's medication regimen is providing more benefit than it is harm.
Mm-hmm. So if it says 3 times a day, it means that.
That is exactly what it means.
No cheating on that.
No cheating.
All right, great. So let's talk about a couple other things that might be risk factors in medication management. Can you help our caregivers understand what those might be?
The first important thing I'd like to pass along is it's important to have a current medication list. And so that current medication list should include your prescription medications, over-the-counter medications, dietary supplements, herbals, and vitamins. All of those can work together or can work against each other. In addition, you should have the dose and the directions included on that current list. It's important to consider what you're going to do when you take the medicine, how it should be taken, as well as what you should expect, both what it's going to help and then what it might harm, so you can monitor for adverse effects. It's good to keep this list in a convenient place. So some people put it on their refrigerator, some people might put it in their wallet or purse, and then you would have it when you go to the doctor's office or to the pharmacy or if there's an emergency.
Absolutely, absolutely. So always keep an updated list is what we try to tell our caregivers. And it's so hard because you have different things added or subtracted.
It is hard because it requires a lot of writing sometimes.
It does. Well, thank you. That was great information. Thank you. So can you tell us about how to keep that medication list current and available, and what are some other important factors that you deem important for our caregivers to think about when they're thinking about medication management?
So, right. In addition to the dose and what you are expecting from that medication, you need to be able to keep track of your administration, because if it needs to be given once a day, or twice a day or 3 times a day, that's what it needs to be given. So it's important to have an administration record, and sometimes that can be as simple as having a calendar that you check off whenever you've taken the medication. Other people may need a more detailed administration record, and you can usually pick up some blanks of those at your pharmacy or doctor's office, or even off the internet you can get those. Okay. I have a friend who created his own using a spreadsheet. And so that had all of his medications that he needed and the information he needed to go along with those. Another option for people that have cell phones is that you could set an alarm. And so you could set an alarm for every day when you need to take that medication, and that would remind you. And then beyond that, if you have a smartphone, you can download an app, and the app can keep up with all of your medications, the list as well as the administration times, and reminding you to do that. Some of the examples I'm aware of is MediSafe and DoseCast. Pill containers are another low-tech way that we can keep up with our medications. People maybe just need to see that they've taken it for that day. And so most of those are 1 week, or they may come in 2 weeks, or even 31 days. So that you can fill them up once a week, or twice a month, or once a month, depending on how many medications. And there are also some that come with multiple administration times each day. And those are usually only a 1 week pill container. And so these help where you can see that you've already taken it.
Right. If it's empty, that means
it's empty. Yeah. Exactly.
So like once a week, you fill up your medicines for that day.
And the caregivers can do that for the patient, and that way they can make sure that things are taken, because they can look as well and help monitor that.
So what about all these high-tech inventions that are out there and marketed that we see for medication management?
Younger people really get excited about these high-tech things. That's right. And some of them can be very helpful. I've known an individual whose mother-in-law was able to stay at home for another year or two because they got one of these medication administration high-tech dispensers. So what it is you program it with when the medications are supposed to be given, and you fill it, and then it will sound an alarm when it's time for the person to take their medication. They press a button and it dispenses what they're supposed to take at that time. So they don't get confused and take extras or just say or forget what day it is, so it's already in there. And then some of them allow monitoring remotely, so the caregiver that might not be able to be in the house or even the vicinity would get a notice if the person doesn't take their medication.
Wow.
That alerts them, or they can look up and see did they get the medication out of the dispenser.
Well, I think the technology is just going to keep expanding and improving.
Well, and it's exciting because it helps people stay at home longer and be independent and be safe with their medications.
Which is what we all want.
Yes.
Keep them at home. I think you have some great tips. Also, I've heard you talk about people that may have low vision. There are some new technologies out there to help them. I know those prescription labels are tiny.
They are tiny, and especially with all the required information that you have to put on them. But what you can do if you have a low vision problem is you can ask the pharmacy to put your labels in larger print. And so that's a simple ask. All pharmacies can do that.
Okay.
Another option is that those pill boxes we talked about, many of them are labeled in Braille. So if somebody does have that ability to read Braille, they can see what is which day of the week or the administration times. They can feel that when they read the Braille.
Container. Wow.
Another option is you can get some gadgets that will read the labels, and so then it can tell you out loud what the directions are.
Wow. Well, again, these young people are figuring this all out and helping us.
That's right.
And that, again, would enable someone to stay at home.
A little bit longer.
And just a simple ask to ask your pharmacy if they can print them in a larger print.
That's all it is.
That's great. Dr. Hutchinson, are there certain things that a caregiver should ask the pharmacy to help with medication management? And if there are, could you give us some suggestions?
Yes, certainly. Always think to ask your pharmacist for any suggestions or help that they can give. Many pharmacies can provide services that would be helpful to help keep people at home longer. One of these is like a pill packing service. And so they can put all of the pills that somebody needs to take at a particular administration time into one package, and so you don't have to fuss with those pill bottles or the dose dispensers that we talked about. So most of the community pharmacies that are independently owned are the places that would do this. It's usually for no extra charge. If you don't have one of those handy or you don't know who those are, there's a website you can go to. And so if you go to cpesn.com, that's for Community Pharmacy Expanded Services Network. And so you can put in your zip code and the mileage and find the pharmacies in your area that would handle that. Some mail order pharmacies will do that too. And there's 185 of those pharmacies in Arkansas. So there ought to be one pretty near most people.
Okay. So we'll put that website up on the screen again, and they just plug in their zip code and see
Yes.
how far they're willing to go to maybe get that service, but it might be worth it.
That's right.
Yeah.
If it helps you stay at home longer or helps your loved one stay at home longer.
Absolutely, absolutely. So I've heard about this thing called medication reconciliation and medication review. Can you help our caregivers understand maybe how they get that done, or is it important to have it done?
Those are both important to have done. So the medication review, or it's also called Comprehensive Medication Review, or CMR for short, it's provided by your Medicare Part D prescription drug program, and so it's paid for by that, and they pay a pharmacist who's been trained to review all of your medications, your prescriptions, your over-the-counter, all the supplements that we talked about, everything, and see if there's anything that's no longer needed, if there's some kind of important drug-drug interaction that's occurring that people don't realize. And then also to make sure the administration instructions don't get too confusing and can be sorted out. And so, as I said, pharmacists are trained to review each of those medications that you're on and decide what needs to be done, and then can work with your provider to get that sorted out for the patient. So you should ask the pharmacist if they have that service at your pharmacy, and if not, again, you can look at that website that I mentioned.
I think we always tell our caregivers to write down everything you're taking, like you said, over-the-counter, herbals, because there could be that secret something that they think, oh, that doesn't matter, but it could be interacting with their prescriptions.
So you also ask about medication reconciliation.
Yes,
so let me explain what that is. It's a little different. And that is usually something that occurs when somebody is discharged from the hospital, or maybe from a rehab facility, or from a nursing home to go back home. And whenever they change these places where they're getting care, then it's important that someone look at the medications they were on before, and then what we are planning to put them on to go home. And so you compare those to make sure you didn't miss something that maybe we didn't continue in the hospital for some reason. And so we'll be sure and get them on those if they need it, or maybe we made some significant changes and they're not supposed to be on all the things that they were on at home before. And so we want to make sure there's no duplications, there's no important drug-drug interactions, and we want to make sure they're on the list that they need to take home with them.
And is it also good to only go to one pharmacy? I've heard some of your talks before. I'm cheating a little bit, but you always talk about try to stay with one pharmacy.
It really helps, because most of our older adults see multiple physicians. And so to have one place where all of your medications are handled can be very useful to make sure that, because they don't always talk to each other as well as we'd like for them to, or as quickly. You know, they can't do it quickly. So certainly that needs to be done.
Try to stay with one pharmacy. Great. Well, great information. Thank you for telling our caregivers about that. And,
my pleasure.
And it's hopefully a free service that they can that simple ask.
Yes,
we just
simple
have to ask.
And they need to ask questions. Be sure you have a phone number and call if you have any questions that arrive in your brain when you go home, because you can't think of everything. It's too complicated.
Absolutely. Thank you, Dr. Hutchison. Yes. This has been wonderful. You have so much good information. Thank you for being with us.
This information has been brought to you by a grant from the Health Resources and Services Administration. Check out more clips on dementia and caregiving at agec.uams.edu.